Good morning, everyone. Our county has now crossed the threshold of 4,000 total COVID-19 cases. From Friday to today, Morgan County has added 130 cases alone. This year has been full of changes and sacrifices. As we move into the holiday season, it is so very important that we consider our actions and what we can do to keep ourselves healthy and well. Today, I'm honored to have with me Decatur Morgan Hospital President Kelly Powers. Kelly, thank you for joining us today. And then we have Decatur City Schools Deputy Superintendent of Instruction and Personnel, Dr. Yvette Evans. Thank you so much, Dr. Evans, for joining us. So just a few updates. Current Morgan County COVID-19 cases are at 4,023 confirmed cases, which brings us to a 5.7% weekly increase. Morgan County is listed as a high-risk county on the risk indicator dashboard, and like we've said, we must remain vigilant. Remember to continue wearing our mask, sanitizing, and practicing social distancing. This week, of course, is Halloween, and as we think about what you need and your household will be doing, please remember that we still need to wear our protective mask, not just the costume mask, and socially distance in your interactions. We do this every week, and I think that y'all are doing a great job of staying in touch with those in your neighborhoods, being a good neighbor, especially to our elderly residents. So with that, Dr. Evans, you give us an update from the schools?
I sure will. The numbers that I'm going to tell you about are the active positive COVID cases and quarantines and isolations. We have 6 student positives and 137 student quarantine and or isolations. In terms of faculty positives, we have 6 positive cases and we have 22 faculty quarantines and or isolations. I'd also like to remind everyone that the Decatur City School System has a nurse on call line. You can call that number if you have any questions and cannot reach our school nurse. That number is 256-318-2171.
Thank you, Dr.
You're
Evans.
welcome.
Well, Ms. Kelly, I understand you moved to Decatur this week.
I did.
Great. Glad to have you here, new resident and leading our hospital.
Thank you.
Love to hear an update from you this morning.
Yes. We currently have 37 positive inpatients. That is up from our high of 34 back in July. We had 39 on Friday, so it's down 2 from Friday, but still 37 is a lot of positive inpatients. We have 6 presumptive under investigations, meaning we haven't gotten their test back yet. We have 6 patients in the ICU and 4 on the ventilator. One thing that I have noticed, Mayor, is that it's a lot of young people. And when I say young, 30, 40, 50, 60s. You know, when in the beginning, most of the patients that were hospitalized were 60, 70, 80, 90-year-olds, and they all have pretty much underlying health conditions. But I am beginning to see some 30s, 40s, and 50s, which does alarm me and should alarm our community in the fact that I think people have gotten a lot lax about wearing their masks, social distancing, and so some of these people, younger people, are getting sick with it. We do have 148 patients today between Decatur and Parkway. We did hit an all-time high of 159 last week. So one of the things I do come and report to you daily is what we call positive patients. So if you're in the hospital and you've been there 2 weeks and you're no longer positive for COVID, but you're still in the hospital, I'm not telling you about those patients. So we currently have several patients who have been in the hospital. I think the longest is maybe 130 days, who were positive, but they're negative. So in the 37 that I present today, those are people that tested positive currently, not people who had COVID before and are now negative, but because of COVID, they're very, very sick. So I think that's one thing we lose sight of, is that there are a lot of sick people in Morgan County in our hospital, total of 159 patients. I currently have 19 ICU beds, and we've been full pretty much the last, I think since July, our census in the ICU has been an average of 18. So there's days where we have 13 and we have plenty, of ICU beds. We are looking at expanding that and adding another 12-bed ICU at Decatur Morgan Hospital if we can get FEMA matching funds for that. But I feel like the vaccine's coming, but I'm not sure everybody's going to take the vaccine. I hope they do, and I hope it's safe. But I want to be prepared for the future so that we can stop the spread going forward. So that's my update.
Very good. Well,
Thank
thank
you.
you so much.
Thank you.
So each week we meet. Amy, do we have a question?
We might have a question.
Okay.
Ever got any questions? Right ahead.
So we're receiving a question from one of our media outlets. Bear with us just a second.
Hey, Jenna. Would you mind repeating that one more time?
Oh, yes. Am I good?
You're good.
Okay, Dr. Evans, I was asking about if you think fall break helped decrease the number of quarantines that we're seeing in the school district right now.
I'm sorry, I didn't. She
Did
said,
fall break help decrease the number of cases that we're seeing in the system?
there may have been a slight decrease in the numbers. We had fall break 2 days, and then we had 3 days for virtual instruction. So kids were actually out of the building for a week. And during that time, we did a lot of deep cleaning and with the electrostatic foggers and all of that kind of stuff to make sure that when they came back, things were in good order. So.
Do you have any other questions, Jenna?
Yes, yes. I just want to make sure that she can hear me. I guess the biggest question I think a lot of parents have and that we have is going back and forth from virtual to in school. Is there a point in time where you will just say, okay, we're going virtual from this point on? I know some school districts are saying, after Thanksgiving, that's it for the rest of the semester. What's the plan for Decatur City Schools?
Right now, we do not have a plan to go virtual. We'll take this on a case-by-case basis. We're doing pretty well in terms of being able to have in-person instruction. And so we're going to just have to take that on a case-by-case basis. It depends on if we see a spike or something like that. It may be a classroom, maybe not the entire school. We would just have to see what happens. But right now, we plan to continue with our in-person instruction, but we do have students who are fully virtual as well.
Okay, and so I want to kind of go back to my first question. I don't know if you maybe didn't hear the whole thing, but I was asking, you had the fall break, but also went virtual, like you said, for that week. And at that point, before you went virtual, you had nearly 500 people out quarantining, and now you're saying the numbers are about 150 total. So do you think that break out of school happened, helped, excuse me?
It probably could have helped, yes. I can't contribute everything to that, but yes, it could have.
And then are you concerned with getting to the point of not having enough faculty? Our neighbors in Lawrence County have now shut down 3 schools because of the number of teachers and faculty out of the building. Do you think that could happen in Decatur? Are you concerned?
Well, right now, based on our numbers, we're not that alarmed. We have, teachers in the building, and so anything is a possibility with this because it's very unpredictable. But if that were to happen, then we may have to go to virtual instruction depending on the number of teachers who are affected.
And the next break that you guys have coming up is Thanksgiving, is that correct?
That is correct.
Okay, perfect. Thank you, Dr. Evans. I appreciate it.
You're welcome.
2 questions for Kelly. Kelly, you had mentioned over the weekend 39 positives. That's the highest we have seen throughout this pandemic in Morgan County, in the hospital. What's your biggest concern right now?
I think, again, my biggest concern, and I mentioned earlier, is the fact that we're seeing more younger people getting this. And, just the fact that the spread. I think not having enough ICU beds is a concern. However, we can use Huntsville and transfer there if we need to. But again, just the amount of young people sort of lets me think that maybe, people are out and about more than they should be, not social distancing, not wearing masks. I guess that's my biggest concern.
What is hospital capacity? You said that there were 159 last week, again, an all-time high. Are you concerned with number of beds? Kind of where are you at capacity-wise?
No, I currently have 44 available beds, so I'm okay on regular beds. I do have a concern about ICU because we're at 19 today, and that's the total that we have. Now, we have a surge plan where we can create 8 more ICU beds and use our part of our emergency room to do that. But I hope we don't have to do that again. So we could go up in ICU beds if we have to.
With the way that the numbers are going, are you preparing for that shift to open those 8 beds?
We look at that daily, ongoing, at least 2 or 3 times a day. So yes, we do keep that surge plan in place. And again, it goes to the number of staffs, RNs that we have with that. But yes, we look at that every day.
Okay, and then how is staff doing? I know that this is, a very hard time for them and very hard for them to deal with. What's kind of the morale among staff in the hospital that have worked, ungodly hours throughout this pandemic?
They're worn out. I think they're tired, and we are looking at all kinds of things that we can do to help them. But yes, they're just tired.
And then last question I have is an update on the COVID unit at the Parkway Hospital. We talked last week, and you said, you guys were aiming for the middle of November. Where are you at now, and are you trying to open sooner because of the high numbers that you're seeing?
Yes, we would like to open sooner. We currently have 9 COVID patients over there on their regular unit today. So that would be 9 of the 15 if we could get it open. We have hired all the staff, but the problem that we have right now is the staff getting here. So some of them have to work out notices where they work now, and then we need to have them trained. So we're still looking at the middle of November with that.
Perfect. That's all I have. Thank you, guys. I appreciate it.
Thank you,
Jenna.
Any others, Emmy?
Not at this time.
Okay. So each week we come and we have this conference, and behind the scenes, behind the cameras, there's a lot of support. And most every week we're joined by Dion Hose from WAFF 48 News, and today's Dion's birthday. So Dion, happy birthday! Thank you for being here. And with that, our next press conference will be Monday, November the 2nd at 10 a.m. Have a good week. Thank you. Thank y'all for coming.